pelvic cavity, the walls of the pelvic cavity, we have four muscles. The first muscle is the piriformis. This muscle is the piriformis on each side. It arises from the anterior surface of the lateral masses of the sacrum and is inserted to the greater trochanter of the femur. It passes through the greater sciatic foramen. This is the greater sciatic foramen, so it arises from here, from the lateral mass, and enters laterally through the greater sciatic foramen to enter into the gluteal region, then the thigh. It is a lateral rotator of the hip, of the thigh at the hip joint, and it is supplied by branches from the sacral plexus. The second muscle is the obturator internus. This muscle is the obturator internus. It is found on the inner surface or the pelvic surface of the obturator membrane. This is the obturator membrane. So from the inner surface, this muscle arises, and it passes into the thigh to be inserted into the greater trochanter of the femur. It's also a lateral rotator of the thigh at the hip joint and supplied by the nerve to the obturator internus, which is a branch from the sacral plexus. Then we have two important muscles that form the pelvic diaphragm, or the inferior floor of the pelvis, or the inferior wall of the pelvis. They are just the same. The pelvic diaphragm is formed by two muscles, which are the levator ani muscle, and posteriorly we have the coccygeus muscle. The levator ani muscle, it arises from the back of the body of the pubis. This is the pubis, back of the body, from here, and this is a linear origin, and then also from the tendinous arc. This white material is the tendinous arc, which is formed by the thickening of the fascia over the obturator internus muscle. It arises also from here and from the ischial spine. Fibers pass medially and downward to be inserted by three fibers, anterior fibers, into the as the levator prostati and the sphincter vaginae in case of male and female respectively, and also intermediate fibers as the puborectalis and the pubococcygeus muscles into the anococcygeal body, okay, which is found anterior to the coccyx but behind the anal canal, and the anterior fibers are inserted into the perineal body, which is found anterior to the anal canal, while the posterior fibers, which are the posterior most, they are the iliococcygeus, inserted into the tip of the coccyx and also the anococcygeal body. So this is the insertion of this muscle. It has three main functions. One of the functions that it forms with the coccygeus muscle, the pelvic diaphragm, which holds and supports the viscera here, the pelvic viscera. It also prevents the rise in the intra-pelvic pressure in the straining and the forced contraction of the abdominal muscles, such as in cupping, and also it has a sphincter action for the anal canal, for the recto-anal junction, and also for sphincter action for the vagina. So this is the function of this muscle, the levator ani. The coccygeus muscle is a smaller muscle. On both sides they are found. They also, with the levator ani, form the pelvic diaphragm, arise from the ischial spine, from here. Okay. This is the ischial spine. Arise from the ischial spine to be inserted into the lower part of the sacrum and also into the coccyx. This is the ischial spine. From here arises into the lower end of the sacrum and the coccyx. It also assists the levator ani muscle and supplied by branches from the fourth and fifth sacral nerves. Okay, this is about the muscles. Then we have the fascia. The fascia in the pelvic region is continuous with the fascia on the abdominal wall above and inferiorly with the fascia in the perineum. It is divided into two parts. There we have the parietal layer of the pelvic fascia and the visceral layer of the pelvic fascia. The parietal layer covers the walls of the pelvis, okay, and it is named according to the muscle it overlies. For example, in the obturator internus is known as the obturator internus fascia, which forms the tendinous arc. Okay. These fasciae, some of them form the superior fascial layer of the urogenital diaphragm, which is formed here, okay, and some of them covers the sphincter urethri muscle. Okay, and then you have the visceral layer of the pelvic fascia. The visceral layer, it covers the viscera inside the pelvic cavity, and in some regions the condensation of it forms ligaments that join the pelvic walls, and they are named according to their site of attachment. For example, the pubo-uterine ligament or the sacro-cervical ligament. Okay, then we have the parietal peritoneum. The parietal peritoneum of the abdomen extends into the pelvis and covers the viscera. It becomes continuous with the visceral layer of the pelvic fascia. And also something else about the pelvic diaphragm. At the anterior most part, it is deficient. It is actually, there's some fibers here also, but like a finger breadth space, it is deficient in the pelvic diaphragm, and through there the urethra and the vagina pass in the female and the urethra in the male. And also from here, the parietal layer of the pelvic fascia become continuous with the fascia below the pelvic diaphragm, which is covering in the perineum below the pelvic diaphragm. It extends inferiorly and joins it to become continuous with it. Okay. Modular. The pelvic diaphragm, the levator ani muscle, with the ischial tuberosities, they form spaces on each side known as the ischiorectal fossae. Ischiorectal fossae. Okay. So each one of them is ischiorectal fossa. Speaker. Tamam. Oh. Nazan basına kadar. Ona erector spinae biçte. Kaşlarına mahvediyor. And this white material, these are the sacral nerves, which join here to form the sciatic nerve. Sacral nerves form the sciatic nerve, which passes through the greater sciatic foramina below the piriformis to enter into the thigh.